So this is a reader's request. If you've been wondering what you should be eating if you've had problems with vertigo, this is the video for you. Hi, I'm Dr. Gregg Gerstin with Align Wellness Center, and I've been working with people to wind up removing the blockages in their health so that they could live amazing, fantastic lives. Vertigo has been a topic that I've helped a lot of people with, and I've helped them manage it naturally without drugs and without surgery, even when they've had failures with their medical doctors, their neurologists, their acupuncturists, their other chiropractors. So in this video, I want to break down for you how I look to manage the chemical stresses for our patients so that they can get back to amazing, fulfilling lives. So this really happens and it gets started, not when you're in the spins of vertigo or when you're having a difficult time getting through day to day. You can apply this to it. But if you're in the spins of vertigo right now, check out this video here on a maneuver that you can wind up doing that has helped so many people. It'll help you get out of the spins right now. And then look in the links below if you want our cheat sheet on how to get out of the vertigo spins. Next up, we're going to wind up going over why what we put in our body or how to eat for vertigo is so important and how to make sure that these episodes don't ever occur again for you and the steps that you need to take. So there's three main ways that our body breaks down, and it's in response to stress. There are three types of them. There are physical stresses, chemical stresses, and emotional stresses. And all three of these build up. We can handle a certain amount, and that's what I call our threshold. Once any one of them gets beyond their threshold or the amount that we can handle, or collectively we reach our total threshold, our body starts to break down. As it progressively breaks down, the way it breaks down gets louder and impacts our lives more and more. If the way your body and stresses have impacted caused you to get vertigo, lightheadedness, unsteadiness on your feet, cloudy-headed or fog-headed, I'm going to talk with you about some of the chemical ways that you can wind up modifying to help support yourself in getting back to living an awesome and fulfilling life. The next one of the other videos I'll do here in the future is how to approach the emotional stresses you run in, and then I'll do another one as well on how to attack the physical stresses you run in. But chemical stresses wind up being the foods that we put in our body, the water we drink, the medications we take, the supplements we take, the detergents we use, the clothes that we wear, the atmosphere that our body is in, and how we wind up allowing it to be in the atmosphere. This is going to dictate how much of that threshold get taken up. So what I want to talk with you about in our next video is going to be some of the things you need to put in your body and don't put in your body in terms of food. We're going to also in this video go into the way that you need to hydrate. We're going to talk about some nutrients that you need to expose yourself. I'm going to warn you about some of the pharmaceuticals that you need to be aware of, and then we're going to talk about how to take the next steps. If you like that or know someone who's been suffering from vertigo and not sure what to do in terms of how to eat, make sure to pass this video along to them. If you like it, give it a thumbs up and smash the subscribe button to get videos just like this. Up next, we're going to talk about what you need to put in your body and what foods you need to eat. Now, when I talk about this, especially if you've had problems with vertigo, I look to be extremely clear. Now, being real clear about this, people don't always like the recommendations that I make, and I make them extremely clear so that there's not questions about it. For that, what I like for you to do is to take your food and make it into like a plate, a circle. And the way I want that plate to be divided is that I want 75% of that plate to wind up being fresh fruits and vegetables. The next 25% I want to be clean, lean proteins. That's what I want your diet made up of. I know. You're gonna ask me, well, can I have a bagel or a donut or cereal or yogurt or cheese or this or that? And the answer is, if you want to get clean and reduce the chemical threshold, we've got to get really clean on what goes in your body. So making sure that you wind up staying clean and keeping it simple so that it's yes or no answers. Is it a fruit or vegetable? Great, go for it. Is it a lean protein? Go for it. Is it not? Don't go for it. Makes it simple for you to succeed on this. Doing this for at least 30 days can wind up absolutely changing your life. So I'm going to guide for you to jump on that. If you've got questions about it, write it below, but I'm going to be real clear on them. If you know someone who needs help, make sure you pass this along. The next step I want to go over, which is ultra important, is hydration. So we're going to switch spots and jump into that. We are significantly made up with water, so we have to be sure that we wind up replacing the water in our body so we can stay hydrated and fresh. So what I find is for most people, they need to drink at least half of their body weight in fluid ounces of water. So for me, if I weigh 200 pounds, then I need to be making sure that I drink 100 fluid ounces a day of water. Now that's pure water. That's not water with lemon, that's not tea, that's not coffee, that's not juice, that's not soda, that's not pop. That's water. If you like those other things, we can add that on top. But we've got to be sure that we're drinking water. Now, if you're nowhere near that in terms of your hydration levels, don't go and do it tomorrow. That's going to really make for a long day in the bathroom. Here's how we're going to get your body used to more water over time. This week, we're going to add 1 cup of water to what you're drinking per day. So if you need to sneak it in the morning when you first wake up, just drink it, or in the middle of the day, go for it. We're going to do that every day for a week. The next week, we're going to add 2 cups of water. Then the next day, 3 cups of water. So eventually, you're consuming a significant amount of water. What this winds up doing for so many people is helps them to stay satiated or full, helps them to eat less, helps them to have more energy, allows every cell in their body to become hydrated, and it lets them flush out toxins that may be in their body so that they're less likely to have vertigo and dizziness. Now I'm doing this right here because it's got our picture of some water. But more importantly, because it's got this powerful quote, "The power that made the body heals the body." That's super powerful. Now let's make sure that the body has the resources that it needs to do the healing. And water is one of the main ones. If you've got questions about this, go ahead and write it below. Oh, if you're on medications that wind up controlling your water, like water pills or diuretics, let's make sure that we connect with your medical doctor that's prescribing them to make sure you're doing this appropriately. But getting your water levels up, massively important. So next up, I want to share with you some nutrients and vitamins that are really essential for every living person right now. The first one that I like to recommend is vitamin D. This is massively important to reduce inflammation and for every cell to turn over. I recommend that you have your blood tests of vitamin D done at least twice a year to track and know where you are. And if you're anywhere outside of the normal range, then we've got to up it. And I guide you to take at least 10,000 international units a day. But you got to get your blood levels checked and tested. Second one, essential fatty acids or fish oils. You've got to wind up taking these 1,000 milligrams twice a day. This will help the cell lining to wind up healing itself and reduce overall inflammation. 2 keys to balancing your vertigo. For many folks, though, they need additional support beyond this. And if you're concerned that you may, go ahead and write down below, and I'll do my best to connect you with one of our functional medicine doctors that have really helped people. They work with people around the world to wind up getting control of their nutrition through micronutrient support and get back to life. So if you've got challenges with it, go ahead and write below, and we may be able to connect you with someone. So one of the reasons that people experience vertigo as well is because of drug interactions. So if you're on some medications, particularly those related to hypertension, depression, anxiety, then you want to make sure you're talking with the doctors that are prescribing them as well. These medications have been shown to have side effects of vertigo. If you're not sure if your medications do, go ahead and pop them into Google and you can see the effects and the side effects. Then once you know them, if it's on the list, you got to talk with your medical doctors about other alternatives so that you no longer have those experiences. Sometimes as well, pharmacists will wind up doing a review with you of all your medications to see how they react and interact with each other. But finding out if your drugs are causing them is really important because we can't wind up getting healthy if we're on things that are taken away from our health. Finding out the cause of those can wind up really helping to change your trajectory. Okay, so we talked a good bit about what to put in your body, eat, and consume, and what not to. These are some key things that wind up helping determine whether you're gonna have episodes or not, and if you're just woozy after episodes, if it's gonna wind up fully going away or not. If you're having challenges with this, write in the comments. I'll look to see if I can help. Also check out that cheat sheet for some more help down in the comments. There's also some other places we gotta look. So in future videos, I'm gonna talk about the emotional stresses you may be running into that are causing the triggers, as well as the chemicals or physical stresses that may be causing vertigo to show up in your life. If we don't address all 3 of them, then you'll wind up continuing to run into episodes. Your health is what you got, and your health is what you invest in it. So it's massively important that we take the time and energy to put our energy into managing our health. naturally so we can do the things that we need to do. Once again, if you know someone who's got vertigo, go ahead and share this with them. Let's make sure they know some of the things that they can do on their own to wind up helping to manage the episodes. And if they can't, let's make sure that they're connected to someone who can. We work with docs around the world that help people to wind up finding the cause of the problem. If you're somewhere around the world and need help, go ahead and write below and we'll be doing our best to wind up finding someone who's near you to start guiding you on how to change the trajectory of where your health is going, manage the episodes of vertigo, the wobbliness that you're experiencing, and so that you can get back to living a full life. Once again, my name is Dr. Gregg Gerstin. I want to thank you for letting me be a part of your health.